All right, ladies and gentlemen, we'll now be having our session on a very pertinent topic in today's time, and that is how can digital health use social determinants of health and improve patient outcomes. So we'll now be joined by our esteemed dignitaries to share their thoughts and views on this subject. So put your hands together for our session chairman, the Director Sales and Marketing at Wellester Healthcare Private Limited, Mr. Sumit Bhattacharjee. Request you, sir, to please join us on stage. Please allow me to now invite our speaker for this session, Mr. Rahul Shinde, Cluster Head, Cardiology and Oncology Business at Lupin Pharmaceuticals. A digital marketer with over a decade of experience in the digital marketing space, Mr. Shinde has held various roles across the digital media landscape in India. In his current role at Lupin, his primary focus is to accelerate digital transformation and driving media tech innovations. Can I request Mr. Sumit Bhattacharjee to please present a bouquet to Sir, to Mr. Rahul Shinde? Can you please? Thank you, Mr. Shinde, for joining us today. And now we'll be joined by our esteemed panelists. With your heartfelt round of applause, please join me in welcoming to the dais Mr. Madhusudan Inamdar, Associate Vice President, Cluster Head at Ajanta Pharma. Mr. Inamdar comes with an extensive experience of around 3 decades with proven track record in healthcare industry. Having a strong business acumen with strategic thinking and innovation approach to make teams successful, he's passionate about building team and transforming performance culture. Request Mr. Bhattacharjee to please present a bouquet to Mr. Inamdar and thank him for joining us today. Can we have a round of applause, everyone? And now, may I please invite Mr. Tushar Bhatt, Divisional Head, Sales and Marketing at Glenmark, to please grace the stage with his presence. Mr. Tushar Bhatt is a seasoned marketing professional with high orientation on medical marketing, communications, interpersonal skills, with experience of handling both anti-diabetic and anti-hypertensive portfolio. I'll request you, sir, to please rise up again and please present Mr. Bhatt with a bouquet of flowers. Oh, it's done? Okay. Super fast, sir. Thank you so much once again, ladies and gentlemen. And, sir, can I please request you to please take ahead the proceedings?
Good morning, everyone. A happy, prosperous, and healthy 2023 New Year for all of you. To all of you, your family, and your beloved ones. Thanks especially Pharma in Future for having such a wonderful platform wherein across the Indian pharma companies have gathered together after a long time, especially a physical meeting, for sharing and caring about the new things or the new dimensions that are happening in the Indian pharma market, as well as some understandings about the global ventures that are happening. Last but not the least, a welcome to all the brighter minds sitting in this forum who are the next generation leaders down the line. Welcome for this meeting altogether, and it's pleasure to have one of the important topic which I personally am very much interested in terms of for the research work that has been gone down the line, and plus moreover it's an apt topic for today for the Indian pharma. And what a forum that we have got, it is about pharma in future. Digital health is the topic which we are going to spend for say half an hour or so. But before that, I just wanted to know from all of you, how many of you in the acute segment or the acute therapy? Just raise hands. Oh, thank you. Can I understand rest of all are in the chronic? Yeah, thank you. So with this understanding, the topic is about digital health. It is not related to only acute or not only chronic, but it is something new which is going to be the future in pharma, which we will be addressing or discussing in the next half an hour or so with the panel members joining together on this forum. convergence of three mega trends that are happening in India. And to put forward in this way, I would say that in the past decade, the heart attack rates in India have increased to an exponential way. COVID definitely has added boost to it. Research and the papers are talking about, or they have evidences to share informations related to in the last 20 years, the heart attack rates have been doubled. And most importantly, of the doubled rates that have happened, 25% have happened in the younger population group, which is in the range of 25 to 55 years. Elderlies are definitely impacted, but now the trend is moving towards the younger population between 25 to 55 years of age. Why this heart attack rates or cardiac arrests are happening to a very exponential reasons? We know all the reasons about it. To put it forward, it is sedentary lifestyle, improper sleep, poor nutrition, alcohol consumptions have increased, smoking rates have increased, and last but not the least, the lifestyle disorders like diabetes and hypertension have also increased the rate of heart attacks in India. And on the other side, when we see about the trends, is about the medical infrastructure is getting stretched further. Now, what does it mean? Are we as a country really full-fledged when it comes to healthcare sector or as a infrastructure as such? No, the reports are definitely talking about something different, that the challenges are existing in the healthcare infrastructure as such in India, wherein inadequate access to basic healthcare services are a concern, lack of skilled and talented medical professionals are a concern, whether in rural or as well as in urban areas, the lack of prevention care, the lack of medical research, and insufficient research funding that is happening. Due to this, there are reports which are again talking about 80% of the healthcare is moving towards digitalization. And that is a basic reason why we are seeing in the last 1 decade or so, the new things are emerging in the Indian pharma markets. We are into the world of Indian pharmaceutical sales and marketing, which I would say that we are into the conventional way of marketing. Today, India is almost more than $49 billion market when it comes to Indian pharma. And when it comes to digitalization, what in earlier sessions we have heard and we also know, when it comes to digitalization intervention by Indian pharma companies, it is majorly driven towards conducting ECMEs, ERTMs, reporting structures. We have gone to iPads, we have gone to EMRs, we have gone to bots, and all these things are happening, which we say about it's a digitalization era that has started in Indian pharma. But on the other side, there are tech companies who have entered into the pharma sectors. And that market is booming and growing at a very exponential scale. The data talks about 1 year back, it is almost $1.9 billion market in India. And there are reports which are talking about it is further going to be scaled up to more than $5 billion market in near future. And there are multiple other reports which are also talking about reaching between 5 to 10 billion market in India. These things are happening today. I think 20 years down the line or back, when we are into the 20 years back or 10 years back, the B pharmacies, the BScs, the BA, all these graduates are getting an opportunity to work in the Indian pharma, but because of the tech companies which are coming up, other graduates, especially who are into digitalization, who are into tech companies, who know about AIs, are entering into this market. And they are growing exponentially. You can see over here, when it comes to e-pharmacy, EHR, deep tech diagnostics, healthcare IT, telemedicine. Then we are talking about online consultations, e-diagnostics, online home healthcare, financial services. These all sectors are evolved in India and are exponentially growing. But the value proposition over here, when we talk about digitalization, the value proposition is more towards customer satisfaction. The needs of the customers are well taken care by these tech companies. Is this digital health? No, it is not digital health. Health and wellness is one of the areas which are exponentially growing in India, which is somewhere having some role to do in digital health. Then what is digital health? I think as a panel we were discussing about, let us understand about what is digital health, what is digital intervention, and how digital health is going to evolve in India very soon, or it has started evolving very soon. Before pandemic, or I would say in the last 1 decade or so, health and wellness was given much importance. But now the trends are moving towards chronic illness disease management. And the value proposition over here is nothing but improving patient outcomes. Improving patient outcomes is a very key concern in globally as well as in India. And when it comes to chronic illness patients, the work has started in diabetes and hypertension, and the work has started in core cardiac illnesses disorders patients, not only in India, but also globally. What is digital health? I would like to give you an brief about an understanding to all of you about what is actually digital health. This is a study presented to in front of you from Johns Hopkins Hospital from US. They have tied up with Apple as a partnership player for ensuring digital health intervention in acute MI cases. A hospital tying up with a tech company to ensure that patient outcomes are well taken care. Almost 1,000 plus acute MI cases are taken into consideration. 200 patients are being put on digital health intervention, and rest are on the control group. Apple-like companies, Nucleus and iHealth, these are the companies which are being associated with Johns Hopkins. Interventions taken in this group was the patients were given a core app to manage their medications, track daily adherence, monitor and track their vitals, especially when it comes to acute MI cases, to avoid the post-hospitalization, to avoid rehospitalization, heart rate, blood pressure, weight, and steps, and the mood needs to be the vital parameters to be looked into. Learn about the risk factors for CVD and lifestyle modifications through educational videos and articles. The partner was Nucleus. And connect with their care team, schedule and track follow-up appointments. Now this is an ecosystem which was built up across, and this ecosystem has ensured that with the help of digital health intervention, the patient outcomes are being well taken care. You can see over here the outcomes which are being published in AHA journal, that is American Heart Association journal, in 2021, the latest report. The risk of readmission within 30 days post-discharge was 52% lower in the DHI group as compared to the control group. Now that is something very important to look into, because patients need to be monitored. Patient needs to have adherence to the prescription and the protocols set by the doctors or the HCPs, and the awareness to the caregivers are a must. So this is the entire ecosystem which was built up by Jocelyn's, and they are pretty doing very well with respect to these patient groups. I had shown in my previous slides with respect to some companies who are actually building up the ecosystem of digital health intervention. Two examples like Livongo, you can refer to the YouTube channels over there, and you can see how the ecosystem is very well built up by Livongo, especially by giving the patients a device and application to ensure improved patient outcomes. Diabetes management with artificial intelligence and with human intelligence, they have ensured that 0.8% drop in A1C has been well taken care. Hypertension management, 10 mmHg drop in BP was well taken care. Diabetes prevention, almost 1.8% drop in BMI, 5.5% drop in weight is been well taken care. You might be surprised that I'm just talking about cardiac illness, I'm talking only about diabetes, I'm only talking about hypertension. But yes, we are, as a pharma industry, we are not only catering to chronic illnesses, especially in diabetes, hypertension, or in cardiac illnesses. We have other patient groups, other patient segments, which each and every person sitting here is working for generating prescriptions from the HCPs. All patients require digital health intervention in near future that will be very helpful for patient outcomes, for their survivals, and for their existence. You can see over here, with respect to chronic illnesses or with respect to chronic disorders, many patient groups can be taken care through this intervention. How does the digital health ecosystem should look like? Or what is the future of digital health? Globally, this ecosystem is evolving. In India, work is on. We are also evolving, and we are definitely moving to an era of digital health. So pharma in future, truly, we believe that we are in the journey towards making a holistic, integrated digital health solution ecosystem for better patient outcomes, where the patient will be the key, where the patient centricity has to be the key. And when it comes to patient centricity, the patient's three important things are very important. One is monitoring, second is adherence, and third is about awareness. Monitoring through vital parameters, because vitals are very important. So over here in this ecosystem, connected device to ensure easy monitoring of vitals and easy access to data on vitals will be the key. Of course, along with that, reminders will be very important for the patients to ensure that the vitals are well documented. Second most important thing is dedicated team of nutritionists and health coaches to drive behavioral change. Patients, either hospitalized or post-hospitalized, they are not well taken care. They definitely do not have a revisit pattern regularly to the HCPs. How we can help to improve their patient outcomes? This ecosystem needs to be built up with considering the nutritionist in place and the health coaches in place who will time to time interact with the patients for better patient outcomes. User-friendly mobile app for ready access to patient records. I think HCPs today are moving from the pandemic times through digital consultations, but what if we are giving a platform to the HCPs wherein ready access data is available on the go to the doctors to check the vitals of these critical illnesses patients, do counseling, connect to the patients, provide the right information, provide interventions, and take care of their outcomes at ease. Last but not the least, what is more important to keep this ecosystem very carefully driven with a kind-hearted approach is the role of a care-giving team or a giving team of experts. The team's role is very clear. First and foremost is connecting with the patients to ensure that the vitals are checked on time-to-time basis. Schedule appointments with the HCPs on time-to-time basis digitally so that they do not miss on the appointments. Keep patients' family updated on their health journey, because every patient have one or the two family members who is concerned about his or her health. What if a caregiver is giving information to the patient's family members in a right way, in a very professional way, so that everything is properly well managed and well informed? Assist for emergency services. These patient groups require emergency services like ambulance, like hospitalization. So these caregivers will be a team who will be at ease to give information immediately to the patient's family as well as to them, and book diagnostics test at ease, which will be helpful to see that the vitals are very well managed. So this is the future what we are talking about to build up the next pharma or the next pharma in future, about the digital health ecosystem, a holistic integrated digital health ecosystem for better patient outcomes. With this, I end my talk and will have some panel discussions with all of you. Thank you.